Welcome. I'm Anya Graney-Elrod, Communications Coordinator at the Center for Celiac Research and Treatment at Mass General for Children. As many of us know, March is National Nutrition Month, and March 8th is Registered Dietitian Nutritionist Day. So today, here we are with my colleague Katarina Mollo, who's a clinical dietitian here at the Center for Celiac Research and Treatment. Katarina specializes in celiac disease and other gluten-related disorders. Welcome, Katarina.
Hi, Anya. It's so great to be here with you this morning, and thanks for having me.
Oh, well, it's great to have you in a perfect time of year.
Yeah.
Now, we will definitely talk about your approach to patient care and all of your work in nutritional education. But first, I'd love to hear how you came to this career, like your kind of career origin story, as it were.
So, yeah, I was actually diagnosed with celiac disease as a young child, and part of my treatment was seeing a dietitian on a regular basis. So, I'm actually originally from Sweden, and over there, you get like gluten-free foods on prescription from a dietitian. So, I saw the dietitian, quite often growing up, and I really thought their job was very interesting. Because I've always, had a strong interest in how food affects the body and health. And I think that really came naturally because when you have celiac disease, foods really do affect you in a major way. And then I moved to the United States in the early 2000s, and it was so hard to find, gluten-free foods. And hardly anyone knew what celiac disease was. Even, most healthcare professionals I talked to, they had very limited knowledge of celiac disease and the gluten-free diet. And because, I felt there was this need for awareness of celiac disease, it kind of led me to specialize in becoming, a dietitian focusing on celiac disease.
Oh, wow. Well, lucky us to have you. So talk a bit more about that, Katarina. Like, how does your own diagnosis influence your approach to patient care, and then also as an educator?
So I think I can understand the many different, aspects of being on the gluten-free diet and kind of what problems people are faced with in their daily lives and like how to manage that. So the gluten-free diet is not just, a diet that affects you what you eat. It also affects you, socially and emotionally. And we all know humans, often interact through food with each other, through, food and eating. And this can often create situations where we have to navigate not only the pitfalls of the gluten-free diet, but at the same time, advocate for ourselves and to have a balanced life. So often I focus on all of these aspects, not just the diet.
Okay, great. And then speaking of nutrition education, on our social media platforms every Tuesday, I'm going to do a plug for you here, Katarina.
Oh, great.
Every Tuesday is Nutrition Tuesday for us. So curated and put together by Katarina is our Nutrition Tuesday posts, which offer some really valuable tips just on what you talked about. Living with celiac disease, thriving with celiac disease, how to be out in social settings, and all of those things. So tune in to our social media posts and our Nutrition Tuesday series. Now, Katarina, I know you had a clinic day yesterday, and none of us really have a typical day on the job, but what's a great day for you? What would you call a great day as a clinical dietitian?
So I really love how I get to help people and follow them kind of on their journey to good health. And sometimes you see such an amazing transformation in people, that go on the gluten-free diet, often after being very sick for a long time. They get more energy back, catch up on their growth and get that spark back in their eyes. And it's a really wonderful journey to be part of. So that's why I really love, my day working with patients. And I also love working at the center with all the wonderful team members, and we have so much fun together, and our work is so interesting. And I feel like I learn something new every time I go into clinic. And in addition, I have a very varied role. I don't just see patients, but I also get to work with you, Anya, like you mentioned on the social media and the Nutrition Tuesdays. Definitely check out the Nutrition Tuesdays, where I focus on a variety of issues relating to celiac disease and nutrition. So it's really a great mix in this role that I do. And so I really love my work.
Oh, wonderful. And we love having you, and what a wonderful asset you are to both the broader public in your educational work and also to the team.
Oh, thank you.
So thank you for joining us today. And also visit our website, celiaccenter.org, because again, Katarina has helped to curate some information on there, particularly how it applies to families, whether your child is going off to college or in a local school. So again, that's celiaccenter.org, and also on our social media platforms. So Katarina, thank you so much for joining us today.
Thank you so much for having me, Anya.
Wonderful. And thank you for joining us out there. And again, watch for the next video.